Hi, I'm Rachel Fox, and today I'm here with Dr. Michael Ast. We're in St. Mary's Hospital. He's a fellowship-trained orthopedic surgeon, and today we're specifically talking about knee replacement surgery. How are you, Dr. Ast?
I'm well, and yourself?
I'm doing well, thank you. So first I want to start by asking you how a patient would know that they need a knee replacement surgery.
Well, knee replacement surgery can be done for a lot of different diagnoses. However, the most important thing to understand is it's for somebody who's in pain. There are lots of different causes for pain in knees, but the most common cause in people over the age of 50 is arthritis.
Okay.
And arthritis is the most common diagnosis that a person would need a knee replacement surgery, although not everyone with arthritis needs knee replacement.
Okay, so you deal with mostly people over the age of, what would you say?
Well, specifically talking about knee replacements, the most common age group is above the age of 60.
Okay.
However, the fastest growing population in the United States is actually between the ages of 45 and 60.
Oh, that's
so
good to
a
know.
younger population of people are now benefiting from knee replacement surgery, which wasn't true a generation ago.
Okay, so if someone realizes that their quality of life is not the best and they want to invest in trying to look into knee replacement surgery, what are some of the things that they do prior to the surgery?
Well, the most important thing to do before you consider knee replacement surgery is try everything else.
Okay.
My wife always makes fun of me because I say, surgery is wonderful and not such a big deal as long as it's on somebody else.
Yeah.
When it's on yourself, it's a very big deal. And so the most important thing you can do is exhaust all of what we call conservative measures. And these would be things like medications, injections, physical therapy, and all of the other types of treatment options for knee pain that don't involve surgery.
Okay.
And only once you've exhausted all of those other options should you really start considering surgery.
So what are some of the options for surgery itself?
When it comes to surgery and you have failed all of the other things, then there are options such as reshaping of the bones if people are very young and have very specific issues. However, once you get into the joint replacement world, there's really two major options, and that's partial knee replacement and then total knee replacement. There's lots of ways you can do each one of those, but ultimately those are the two basic categories.
What are some of the advances that have come through with knee replacements that these two surgeries are able to really fix the problem for some of these people?
I think the biggest advance that you've seen in the last 15 or 20 years in knee replacement surgery has been pain control.
Okay.
I think a lot of the things that you hear talked about a lot as making this better really are just functions of our ability to control pain. If you think about how knee replacement started, it used to involve a week or so in the hospital and then a month in a rehab center, and you get moving very slowly. And because of our ability to control pain and have people moving more quickly, now patients are going home the next day or the same day of surgery. They're walking as much as they'd like immediately after the surgery, and people have been able to get back to much more active lifestyles because of that. The other advance has been in our ability to make implants that are superior to the ones in the past. So I brought with me today a knee replacement implant, and it's usually made of a couple of different parts, the most important of which are the two parts that rub together. And that's the part that caps the end of the femur or thigh bone, as well as the plastic part in the middle.
Oh, wow.
And this is where most of the advances have come in this piece of plastic. Over the years, the plastic has become a better technologically advanced plastic that has started to last longer. And the part that it rubs against, we've gotten better in terms of making it smoother, harder, and that allows the implant to withstand much more impact and much more abuse, as we call it, and also allows it to last much longer than the older ones did.
Okay, so what are the typical lifespans for a replacement like that?
That's a great question. And the reason is that we always talk about this knee is going to last you for however many years. What we know is that based on today's data, we believe most knee replacements should last 20 or more years. You'll even see advertisements specifically by the companies saying this knee is going to last you 30 or more years. Keep in mind that knee replacement has only been around for about 12 years.
Right.
So what can I tell you? It'll last you 12 years.
Okay.
But what we know is that based on the implants and the technology we have today, most knee replacements are still functioning at 20 to 25 years. Beyond that, we don't have the data, but we believe, based on what we know now, that it should continue to last, and ultimately we hope that we can make knee replacements that last a very, very predictably long time.
Yeah, that's great. So what other things do you do to prevent complications to the surgery?
You know, there's two things that you have to think about when you think about complications to the surgery. The first are patient factors, and the second are surgery factors. And I think they're very different. The most important thing that a patient and a doctor can do together is to make sure you're the right patient for surgery. And that means your heart is healthy enough to go through the surgery, your lungs are healthy enough to go through the surgery, you have no major risk factors for infection, because infection is a big problem after knee replacement surgery. So a simple thing like making sure you go to the dentist and have no active infections in your mouth, because those can actually spread to your knee replacement. The other thing is making sure you're screened for problems associated with joint replacements like blood clots. People with histories of blood clotting problems can be at very high risk for a blood clot after the surgery, and this needs to be addressed adequately at the time of surgery and after surgery in order to make sure that a patient is at the lowest risk. Then there are the surgery factors, which involve actually doing the surgery appropriately, doing the right surgery for the right patient, and it usually is best handled by a surgeon that you trust, who has experience using whatever knee replacement implant they use, because there's not a huge amount of difference between any of them, and making sure you have an open and honest communication between the doctor and the patient, because that actually is probably what is the most important thing for the outcome.
So what are some facilities that you have here at St. Mary's Hospital that help prepare people for knee replacement surgery?
You know, we've been very lucky here at St. Mary's with some of the programs that are in place. The Next Day Orthopedic program can help you find an orthopedic surgeon in a timely fashion to get yourself in to discuss with a trained surgeon as to whether or not you might be a candidate. And then I think one of the things we excel at the best here has been both our pre-rehabilitation as well as our post-operative rehabilitation program, which involves a very strict protocol of evaluating patients' home needs as well as their physical needs prior to the surgery. We actually have people do a physical therapy round before they have the surgery, so that they understand how to use a cane or a walker after surgery, which will be necessary for a short period of time. And then the day of your surgery, that afternoon, you're already up and walking around, you're walking to the gym, you're starting to do your therapy, and your home needs have already been evaluated. Because unlike in the past, the vast majority of patients are going directly home from the hospital nowadays, and so the therapists have already evaluated your home needs, made sure you have any of the extra equipment you might need, and then have your home physical therapy already set up before you're out the door.
I think that's great. I think a lot of patients worry about but definitely post-op, and they're all worried about going home on their own. They don't have the doctors and the safety of the hospital, so that's a great resource.
And it is nice that you do get to go home and you are not on your own. So at St. Mary, we do send a nurse and a physical therapist to your house every single day for about 2 weeks, and they help you with all of your needs around the house, as well as make sure you're doing your therapy, because the therapy is such an integrally important part of knee replacement surgery. I tell everybody I'm a very small part of the success of your knee replacement. It's really the patient and the therapist that do the most work.
Yeah, that sounds great. So you were saying there's not much difference between the different types of replacements, but what are the different options that doctors might look into for a knee replacement?
So there are many options out there, and like I talked about before, there are partial knee replacements versus total knee replacements, but that's really a decision based on the patient characteristics. If you have arthritis that is not spread throughout the entire knee but just in one part, then partial knee replacement is an option. When people talk about implants, they talk usually about total knee replacement implants and the ones out there on the market. And just like there are cars made by Ford and Toyota and Hyundai, there are also knee replacements made by different companies, and each of them has their own, what I like to call bells and whistles. But ultimately, we're all designed from the same starting point and have really developed in such a way that most of the time they are very, very similar. Each one has little advantages. The one I use I happen to like because it comes in an option that you can have without nickel. And nickel is a metal that people are very sensitive to, so a very small percentage of the population who usually know it because they put on jewelry and their ears or their fingers turn green or get red. And so having that as an option in a knee replacement, I think, is nice for people who are sensitive, but that's a very, very small percentage of the population. Really, when it comes to choosing an implant, I tell patients, choose a surgeon and then let them use whatever they want.
Okay.
Because most surgeons use what they're comfortable using,
Right.
what they have used since their training or for many years. And if you go in and ask them to use a different implant, you're going to end up having them working with something they're not comfortable with. And like I've told you, the most important thing is the surgeon's comfort and your comfort with that surgeon. Everything else is
Yeah,
extra.
Definitely. I agree with everything you're saying. So what can a possible patient do to research the knee replacement, or a doctor rather, that they'd be comfortable with choosing?
I think the key with picking your doctor or finding a doctor is finding a doctor you're comfortable with, someone who has experience doing knee replacement surgery, and then you go meet them. A lot of times, what I always think is the best way to find a good surgeon is to ask around. With nearly 1 million knee replacements being done in this country every single year nowadays, there's lots of people out there.
Bound to be someone.
Go to church, go to the mall, find your friend, and then usually asking them gives you a good sense, because you know if somebody had a good experience, there's at least a little bit of a confidence you can have that that doctor will do a good job. And then when you meet them, don't be afraid to ask questions. Do you do this surgery a lot? How comfortable are you with it? Am I a good candidate in your eyes? These kind of questions, it's kind of like a first date, because like I tell my patients, after I've done your joint replacement, you and I are married. That's it. Because for the lifespan of your knee replacement, which is going to be your lifespan,
Right.
you're stuck with me.
Yeah.
We're going to go together through the ups and downs, and we're going to work through it. So you want to have a doctor-patient relationship where both people are trusting of each other. And when you find a doctor that you like, that you make a good relationship with, that's who you choose.
Yeah, I think that's very helpful to all of our viewers. And thank you so much for sitting down with us today, Dr. Michael Ast, and hope everyone else has a great day. Thank you.
My pleasure. Thank you.